in prostate health awareness, awakening the society in the age group of men from 40s, 50s to 70s, 80s. The changes which are so subtle and so slow, many a times are missed out by men in the society in the busy life. In those prime years of life, between 50s to 80s, where men are busy with so much in their most mature years and most formative years, and obviously the most successful years, there are progressive changes happening which are bringing them down, which are bringing them actually to a situation from where it sometimes can be recoverable and irretrievable. The bladder contraction and the passage opening up is a common phenomena where we go and open the zip and pass urine multiple times a day for the last 50 years, 60 years. But the progression of change, which is measured many a times in a health checkup, where a prostate health change is picked up by a prostatic enlargement, from a 10 to 15 grams prostate, a prostate changing to 25, 35, 55, 100 and 200 grams prostate, gradually and slowly over decades. On the other side, the flow gradually going down, which is missed up many a times by individuals because it's a very slow and progressive change. The change is millimeter by millimeter, centimeter by centimeter, and this change does not stop. Many a times, as urologists in this country and across the world, we look forward to meeting men earlier than later. But what happens is people present with emergencies of bleeding in urine, present with prostate hugely enlarged, present with medications being given for days, months, years, or decades, and the results are not working, or they never did work so well, but it was on moderate therapy that they were managing themselves, or absolutely brand new patients who have no idea about what prostate is and what prostate health means. And they know that their fathers and grandfathers went through urinary complaints in that prime years of life. So why not wake up to the prostate health awareness and awakening in the month of September, which is celebrated as the Prostate Health Awareness Month? At the Kokilabenhospitalmumbai Hospital, on one side, while I continue to treat patients of prostate cancer, which in early stages and localized prostate cancer, we do robotic assisted prostate cancer removal, robotic assisted radical prostatectomy, where in a 6 days stay, your prostate has been removed by the robotic technique, which is a precise technique. The cancer has been completely removed and the anastomosis between the urethra and the bladder has been achieved, and for which patients continue to do well in the understanding that they have got their disease completely removed because it was picked up early and localized as a result of the biopsy showing a cancer, PSMA PET scan showing a localized disease. And once that is completed, the job is all about follow-up and surveillance. Job is about looking at their continence as early as possible, looking at their functions, capabilities, and erections. On one side, while I deal with the prostate health on the cancer side, where we remove the prostate internally completely by a robotic approach through those 3-4 keyholes. We go in and remove the prostate, join the bladder to urethra. We also look at individuals who continue to have erectile dysfunction after the prostate removal and still very young and capable, but find themselves incapable in the bed. We also look at incontinence or the male incontinence, where men after prostate surgery are continuing to leak urine and are living in diapers. So that's a part and parcel of the large package at the Kokilabenhospitalmumbai Hospital and the Department of Urology, which I undertake. So prostate health is important. The consequences of prostate health therapy and cure is also equally important to us. And therefore, don't let yourself feel down that things are missing and things will not be get cured. You will. Once that happens around, you only get better. You only get confident enough that my therapy is completed. On the other side, for all men, which could be 70, 80, 90% men in the world, prostate is undergoing a change. From a small lemon-shaped 10 to 15 grams prostate, a walnut-shaped gradually increases to a size of anything from 10, 15 to 20, 50 and 100 grams and 200 grams. The prostate then could bring about symptoms and change. And because it's so slow, many a times you forget it. And therefore, the awakening is about looking at your prostate symptom score or your prostate score. Are you scoring well? Are you passing urine well? On one side, I see the society. Other side, I see doctors. Doctors, urologists, cardiologists, physicians, gynecologists, male, who actually have got urinary complaints as men and who continue to have prostate issues, come up and talk about minimally invasive prostate surgery, where we don't actually operate. We go in and we actually clip the prostate and open the obstruction, which was gradually obstructing over years and decades, and which medicines don't work now, or medicines never worked, or the emergency has been created by worsening symptoms. So the era 2024, September month, is different from the era that I spoke in on the same channel last year and the year before last and thereafter. The issue here is, I think we have arrived at a pinnacle. In present times, the kind of practical work that is being done at the Kokilabenhospitalmumbai Hospital Department of Urology on prostate health, which could be very advanced prostates, a large prostate of 150, 200, 300 grams, which will not be obviously removing through the urethra, but by a robotic approach for benign tumors, for the benign prostate enlargements. It's called the adenectomy or the Freyr's prostate removal, which does not impart anything, any wrong to the urethra, and therefore away from the urethral trouble. On the other side, the smaller prostates, anything between 35, 40 grams to 80 grams, giving a lot of trouble. Today, by minimal invasive treatment and without a surgery, obviously with the endoscopy routine, all individuals who are living with catheter, who cannot pass urine well, whose medicines are not acting, and who continue to have this trouble, deserve to be treated by a urolift or a minimal invasive surgical treatment where no anesthesia, even if you are a high risk under local anesthesia, over 10, 15, 20 minutes, we're able to probably open up the passage which was gradually blocking over months, years, or decades. So, friends, we live in a different era compared to what we were, and the era will gradually change year and year later. Things will actually get only better with the kind of understanding we have of the science today. Obviously, we are flowing in all directions, and all directions need to be imbibed to be looking at what is the best therapy for this individual. Therapies may be many, but the motto that I follow is right approach to the right individual, and that's what we need to take forward. That I speak loud and clear here is because the result has to be equally loud and clear. We look forward to more and more patients seeing their urologist in their cities, in their countries, and reaching in time. Obviously, there is a niche area of work on male incontinence, living on diapers. There's a niche area of work on erectile dysfunction, post radical prostatectomy, or young men with diabetes, smoking, pelvic issues. There is a niche area of radical robotic prostatectomy where the prostate cancer localized to a prostate is removed completely, anastomosis achieved, and men develop their continence back over the next few days to few weeks, and thereafter live a better life. On the other side are those benign non-cancerous prostate, which is a large volume of work perhaps individuals suffer from. I said very slow, very progressive, picks you up at the mature years of your life and you hardly know about it. As it progresses, it troubles, and the trouble can only be more and more significant. So, friends, while we take this subject forward, the Prostate Health Awareness month will come again in 2025. So, 2024, with half the month gone, wishing to reach everybody on prostate issues from the Kokilabenhospitalmumbai Hospital in the Department of Urology and taking it forward to the next level. I'm Dr. Sanjay Pandey, consultant urologist at this hospital for the last 16 years. Thank you so much. Always